I am Aditi KP. I am presenting the topic activation modulated drug delivery system. So the rate controlled drug delivery system can be classified into rate pre-programmed drug delivery system, activation modulated drug delivery system, feedback regulated drug delivery system, and site targeted drug delivery system. So I am here discussing about activation modulated drug delivery system. So the drug release from the drug delivery system is triggered by or activated by physical, chemical or biochemical process or assisted by externally supplied energy. So the drug release rate is managed by adjusting the applied process or the amount of energy input. So when a process is applied, the drug reservoir is activated to release the drug at constant and controlled rate. So based on this, the nature of the process applied or the type of energy used, the activation modulated drug system can be classified into physical means, chemical means, and biochemical means. The physical means include osmotic pressure activated drug system, hydrodynamic pressure activated drug, vapor pressure activated drug system, mechanically activated drug system, magnetically activated drug system, sonophoresis activated, iontophoresis activated, and hydration activated drug system. In chemical means include pH activated, ion activated, hydrolysis activated drug system. In biochemical means include enzyme activated and biochemical activated. So this is the diagrammatic representation of activated modulated drug delivery system. So here to include the components are drug reservoir, energy sensor, and rate controlling surfaces. So the drug is stored in the drug reservoir. The energy sensor which dictate the external stimuli and activate the system. So drug controlling surface which modify their permeability property. So in physical means the first one is osmotic pressure activated drug delivery system. Here the osmotic pressure is utilized to activate the drug release. So the drug reservoir is maybe in solution form or the solid form which is enclosed within the semi-permeable housing with controlled water permeability, and the drug is activated to release in solution form at a constant rate through the special delivery orifice. So the release rate is adjusted by managing the osmotic pressure gradient. So we already said that the drug reservoir may be in solution or solid form. So if it is solution formulation, the intrinsic rate of drug release, that is Q by T, is equal to Pw Am by Hm into pi S minus pi E. For the solid dosage form, solid formulation, the Q by T is equal to Pw Am by Hm pi S minus pi into St. For the Pw is the water permeability, Am is the effective surface area, Hm is the thickness of the semi-permeable housing. So the pi S minus pi is the differential osmotic pressure between the drug delivery system and environment. So St is the upper solubility of the drug contained in the solid formulation. So the examples include Alcet osmotic pump and Acutrim tablet. Acid osmotic pump. So it is an implantable or insertable controlled drug delivery system. So here the drug reservoir is normally solution formulation which is contained within the collapsible impermeable polyester bag. So external surface is coated with a osmotically active salt such as sodium chloride. Then this reservoir compartment is then completely sealed inside the rigid housing walled with a semi-permeable membrane. So at the implantation site, the water component in the tissue fluid penetrate through the semi-permeable housing at a rate and dissolve the osmotically active salt. So this created an osmotic pressure in the narrow spacing between the flexible reservoir compartment wall and rigid semi-permeable housing. Under this osmotic pressure differential created, the reservoir compartment is forced to reduce its volume and the drug solution is delivered at a controlled rate through the flow modulator in the system. By varying the drug concentration in the solution, the different doses of drug can be delivered at a constant rate for a period of 1 to 4 weeks. So the DORS for delivering the protein and peptides and osmotic modules are the example for such drug delivery system. So this is the cross-sectional view of Alcet osmotic pump. This is the semi-permeable membrane. The water entered through this semi-permeable membrane and inside which the osmotic agents are present. Then this is the drug reservoir. The drug reservoir is coated with flexible impermeable wall. So inside the drug is present, then is drug is leaving through this delivery portal. Next is acutrim tablet. So acutrim tablet is a solid tablet containing water soluble and osmotically active phenylpropylamine hydrochloric acid. So which is enclosed within the semi-permeable membrane made up of cellulose triacetate. So the outer surface of this membrane is coated with thin layer of the same phenylpropylamine for immediate release. So when the drug is administered and it entered to the gastrointestinal tract, and the gastric fluid dissolved this outer phenylpropylamine layer, then delivering an initial dose. Then the water is gradually permeated through the semi-permeable membrane at the rate governed by PWM by H by M, dissolved in the controlled release phenylpropylamine. Under the controlled osmotic pressure differential created, the phenylpropylamine solution is delivered continuously at a controlled rate through the orifice pre-drilled by laser beam. So the duration of action is 16 hours. So the oral delivery of indomethacin and oral controlled drug delivery of nifedipine and metoprolol are the example of this type of tablet. So this is the cross-sectional view of acutrim tablet. The drug is enclosed inside the semi-permeable membrane. Then after this, immediate release layer is coated. So through this drug delivery orifice, the drug is released. Next is hydrodynamic pressure activated drug delivery system. So the hydrodynamic force or the pressure is a source of energy for the activation of drug release from the drug delivery system. So the system is made up of collapsible impermeable container which contains liquid drug formulation to form a drug reservoir compartment. This drug reservoir compartment is inside a rigid shaped retaining housing. So the laminate of absorbent layer and swellable hydrophilic polymer layers is sandwiched between the drug reservoir compartment and the housing. So in the gastrointestinal tract, the laminate layer which absorbs the gastrointestinal fluid through the annular opening at the lower end of the housing and become swollen, and which generate the hydrodynamic pressure in the system. So the hydrodynamic pressure which forces the drug reservoir to reduce its volume and causes the liquid drug formulation to release through the delivery orifice at a rate defined by Q by T is equal to PF AM by HM theta S minus theta E. Here the PF is the fluid permeability and AM is the effective surface area and HM is the thickness of the valve with annular opening. So theta S minus theta E is the difference in the hydrodynamic pressure between the drug delivery system and the environment. So this fluid permeability, effective surface area and thickness of the valve which are the factors which influences the release of rate from the drug delivery system. Next is vapor pressure activated drug delivery system. Here the vapor pressure is the energy source to activate the release of drug. So the drug reservoir which is exists as a solution formulation. So it is contained inside the infusible compartment. It is physically separated from the pumping compartment by a freely movable partition. So here the two compartments are present, infusion compartment and pumping compartment, and is separated by a freely movable partition. So the pumping compartment which contains fluorocarbon fluid that vaporizes at the body temperature at the implantation site and creates a vapor pressure. So under the vapor pressure, the partition moves upward. This forces the drug solution in the infusion compartment to be delivered through the series of flow regulator and delivery cannula into the blood circulation at a constant flow rate. Here the rate of delivery is equal to d raised to 4 ps minus pe by 40.74 mu L. The d is the diameter, inner diameter, and L is the delivery length of the delivery cannula. Ps minus P is the P is equal to the difference between the vapor pressure in the pumping compartment and the pressure at the implantation site. So mu is the viscosity of the drug formulation used. So an example of this type of vapor pressure delivery system include implantable infusion pump for the constant infusion of heparin in the anticoagulation treatment and insulin in the anti-diabetic medication, infusion pump for the morphine of the patient suffering from the intense pain of terminal cancers. This is the schematic representation of the vapor pressure activated drug delivery system. Here we already said there are two compartments. This one is the infusate compartment, and this is the pumping compartment. So the pumping compartment is filled with fluorocarbon. When it is in the body temperature, the fluorocarbon is vaporizes and produce vapor pressure, and this is the partition, and when the vapor pressure is produced, the partition is moves upward, then release the drug through the orifice. This is the flow regulator. Through this flow regulator, the drug is released. Mechanically activated drug delivery system. So here the drug reservoir is a solution formulation which is retained in the container which occupied with the mechanically activated pumping system. So the volume of solution delivered is controllable. As small as 10 to 100 microgram per liter is delivered, and is independent of the force and duration of activation applied, as well as the solution volume in the container. So example is metered dose nebulizer for the international administration of precise dose of buseril, and dried powder inhaler and nebulizer. So metered dose inhaler, which is commonly used for the treatment of local diseases like COPD, asthma. So the metered dose inhaler consists of metered valve, actuator, mouthpieces. So metered dose valve is designed to deliver precise aerosol amount at each actuation. So this is the these are the pictures of the mechanically activated drug system. This is the first one is nebulizer, second is metered dose inhaler, third one is dry powder inhaler. Magnetically activated drug delivery system. In this type, the drug reservoir is a dispersion of peptide or protein powder in a polymer matrix from which the macromolecular drug can be delivered only at a relatively slow rate. So, this low rate of delivery can be improved by incorporating an electromagnetically triggered vibration mechanism into the polymer delivery device. So the this magnetically activated drug delivery system device is fabricated by first positioning a tiny magnet ring in the core of the hemispherical drug dispersing polymer matrix, and then coating its external surface with the drug impermeable polymer such as ethylene vinyl acetate copolymer or silicone elastomers. So but the one cavity at the center of the flat surface which is not coated with drug impermeable polymer. So this uncoated cavity is positioned directly above the magnet ring, which permit the peptide drug to be released. So you can see here the uncoated area. This area provide the release of peptide drug, which is above under this magnet ring is present. So the one example is hemispherical magnet delivery device produced has been used to deliver the protein such as bovine serum albumin, and also it is used for the therapy of tumors. The magnetic doxorubicin in liposome. Next is sonophoresis activated drug delivery system. Here it utilizes the ultrasonic energy to activate the delivery of drug from the polymeric drug delivery device. So the system can be fabricated from either a non-degradable polymer or bioerodible polymer. So non-degradable polymers such as ethylene vinyl acetate copolymer, or the bioerodible polymers such as polybis p-carboxy phenoxy alkene anhydride. So the sonophoresis equipment consists of piezoelectric crystal and a coupling medium. The ultrasound is produced when electrical energy converted into the mechanical energy by the piezoelectric crystal, thereby generating an acoustic wave. On apply ultrasound, the micro bubbles produced leading to collapse of bubble at the surface of stratum corneum gives rise to a shock and makes skin permeable. So acoustic microjets also produced cause penetration of the stratum corneum. So the detrimer coupled sonophoresis mediated transdermal delivery system for diclofenac, and the use of ultrasound to deliver the molecules of lidocaine for local anesthesia are the example of this type of activation delivery. So this is the sonophoresis activated drug delivery system. So the ultrasound is used to activate the transdermal delivery of hydrophilic molecule like mannitol across the indirect tract skin. So representing this structure. And the fluorescence activated drug delivery system. Here the uses the electrical current to activate or modulate the diffusion of charged drug molecule across the biological membrane in a manner similar to the passive diffusion under the concentration gradient, but much facilitated rate. So endofluorescence facilitates skin permeation rate of the charged molecule consists of three compartments such as passive skin permeation flux, electrical current driven permeation flux, convective flow driven skin permeation flux. So the JEISP is equal to JP plus JE plus JC. Here the JP is equal to KS dx DC by HS. The J is equal to ZI DIF by RT CI into DE by HS. And JC is equal to K into CS IT. So the Ks is the partition coefficient of the interfacial partitioning from the donor solution to the stratum corneum. The ds is the diffusivity across the skin, and di is the diffusivity of the ionic species in the skin, and ci the donor concentration of ionic species in the skin, and cs the concentration of in the skin tissue. dE by HS is the electrical potential gradient across the skin. dS by HS is the concentration gradient across the skin. Zi is the electrical balance of the ionic species I. ID is the current density applied, and as the gas constant, F is the Faraday constant, K is the proportionality constant, and T is absolute temperature. The examples are the percutaneous penetration of anti-inflammatory drugs such as dexamethasone sodium phosphate to surface tissue, and the endophoretic transdermal delivery of insulin, a protein drug, in the control of hyperglycemia in diabetic animals. So next is hydration activated drug delivery systems. This type of activation drug control delivery system depends on the hydration induced swelling process to activate the release of drug. So in this system, the drug reservoir is homogeneously dispersed in the swellable polymer matrix fabricated from the hydrophilic polymer, and the release of drug is controlled by rate of swelling of the polymer matrix. The example is Synchromate B implant. It is fabricated by dissolving the norgestomate, this is a potent progestin, in the alcoholic solution of linear ethylene glycomethacrylate polymer, and the polymer chain is then cross-linked with ethylene dimethacrylate, this is a cross-linking agent, and form a solid cylindrical drug dispersion hydrode implant. This tiny subdermal implant is engineered to release the norgestomate upon hydration in the subcutaneous tissue at a rate of 504 microgram per centimeter square per day, up to 16 hours for the up to 16 days for the control and synchronization of the estrus in the livestock. Then another example is a valve release tablet, which is prepared by a simple pharmaceutical granulation process of the homogeneous dispersion of allium in hydrocolloid and the pharmaceutical excipients, and this granules then compressed into form a compressed tablets. After intake of this tablet, the hydrocolloid absorbs the gastric fluid and form a colloidal gel that starts from the tablet surface and grow inwards. So the release of allium molecule is then controlled by the matrix diffusion through this gel barrier. So the tablet remains buoyant in the stomach as a result of the density differences between the gastric fluid and gelling tablet. Here the gelling tablet density is less than the gastric fluid, so that it is buoyant in the stomach. In addition to these hydrophilic polymers, the lipophilic polymers such as silicone elastomers can also be modified to have swelling property. This is achieved by the impregnating a water immiscible liquid such as glycerol or water soluble salt such as sodium chloride in the lipophilic polymer matrix. When it contact with the aqueous medium, the modified lipophilic polymer becomes swollen as a result of continuous absorption of water by the hydrophilic additive in the polymer matrix, and this activates the release of drugs, peptides and non-peptides at a significant enhanced rate. So this is the diagram showing the hydrogen induced formation of a colloidal gel barrier. When it enters the gastric fluid, when the gastric fluid is absorbed, the hydrochloride becomes swollen and form a colloidal gel barrier. And so the summary conclusion, activation modulated drug delivery system offer a controlled and regulated approaches to drug release by utilizing physical, chemical, biochemical triggers. This system enhances the drug efficacy, minimizes the side effects, and provide the precise dosing. Among various activation mechanisms, the physical means such as osmotic pressure, hydrodynamic pressure, magnetically activated drugs, etc. have demonstrated significant potential in the improving therapeutic outcome. Additionally, the sonophoresis and endophoresis techniques enable the transdermal drug administrations, increasing the bioavailability. So the references are